Hi, Kevin Henry, the Group Editorial Director for Advanstar, and I'm on a Google Hangout today with Mike Uretz. He is a nationally known EHR and health IT educator and consultant. He's been involved with federal electronic health record mandates and incentives since they were first introduced, and is presently assisting dental practices and groups with obtaining incentive monies. He's also providing guidance to dental software vendors wishing to become EHR certified. He is the founder of dentalsoftwareadvisor.com, a great site, might I add, and that's a trusted industry resource on dental software information. I'm also glad to call him my friend. I know a requirement for the EHR incentive program is that they must, the practice I should say, must use a certified EHR system. Can you explain to our viewers what that means?
Oh, absolutely. That's near and dear to my heart. In fact, being a techie myself and a geek somewhat, I've actually worked with vendors on this. So the federal government, as part of the program when they started it 2.5, 3 years ago, said basically that we will have certain basic requirements, certain feature sets, like, for example, electronic prescribing, like the ability to get patient education electronically, like certain orders for imaging. A lot of different features need to be in the software. And so the federal government has contracted with various testing centers around the country to test vendor software and make sure they qualify. Now, it's interesting because there are various stages. Okay, the way this works is that the federal government initially wanted vendors to just be able to get data from practices and patients, but the golden grail here is to be able to do something with the data, to analyze it, to see how to improve patient care. And so there are various steps and various features that will be added over time. But to answer your initial question, a vendor needs to be certified by one of these testing bodies for EHR, and then they'll be on a list, and then any practice is eligible if they use their software.
And Mike, after our viewers have watched this information, how can they get in touch with you for more information or if they have more questions?
Well, I guess probably the best way, Kevin, is if they want to email me at Mikeu, M-I-K-E-U, at dentalsoftwareadvisor.com. Probably the best way to get a hold of me. They can also call at 425-434-7102. I'd be happy to answer any questions. I really want to make sure that folks really understand this program because it can be very confusing.
Mike, as always, I really appreciate your insight and your time. Thank you so much.
Oh, thanks, Kevin. I appreciate it.